Hello, I'm Kelly Craig, and we've teamed up with Cleveland Clinic, Florida to get Heart Healthy, a series of interviews that could save your life. Our guest today is Dr. Edward Savage, and we're talking about symptoms that everybody should pay more attention to when it comes to our hearts. Hello and good morning.
Good morning.
Do we as human beings tend to go into denial when certain things start happening in the chest area? We think, this isn't happening to me. We'll just go on about our business. It'll go away like anything else.
Well, not just denial, because some people who have real symptoms, but some of the symptoms of heart disease can be very subtle. And what I say to patients is, have you adjusted your lifestyle to compensate for changes that you may not even realize have been happening?
Ah, I see. And sometimes that's on a subconscious level. We don't even know we're doing that.
Absolutely. For example, if you decide not to go up the stairs, or if you take the elevator where you used to take the stairs, or somebody drops you off at the storefront instead of you walking from the car. So subtle changes that you may not even realize you're making, or you may attribute to, quote, old age.
Ah, good point. Tell us about some of the symptoms, specifically different for men and women?
Well, there's different types of heart disease that can cause different symptoms. The classic narrowing in the arteries on your heart can often cause chest tightness, but you also can get other symptoms such as pain in your jaw, pain in your neck, pain in your back. You can even have, quote, heartburn as the symptoms of coronary disease. Other types of heart disease, like valve disease, can actually present without those typical, quote, heart symptoms. Shortness of breath, fatigue, generalized fatigue, inability to do the things that you used to be able to do. And these are symptoms that are less often talked about and can be more subtle.
So tell us, when should we see our doctor? When should we really be concerned? When it becomes a pattern? When
it becomes a pattern, when you've noticed a change, when you have an acute bad symptom, or when you look at your spouse or family member and you notice a change in them that they haven't recognized.
Very good. That is so important, because sometimes we just think they're in a mood, or we're getting older, or these things happen with age. Great, great point.
Absolutely. In fact, when I have a spouse with the patient will often say, no, I don't have that problem, and then you look at the spouse and they're nodding their head yes.
Oh.
To say that yes, they're just not acknowledging the symptom they have.
All right, great, great points. We really appreciate that. And also, difference with women.
Women can have, particularly with coronary disease, the narrowing of the arteries, they really can have some atypical symptoms. When people say chest pain is the most common thing associated with a heart attack, well, people think chest pain, they think actual pain, but if you ask some of these people what their symptom is like who have heart disease, and then you walk in the room and you say, you're getting pain, they say, no, I have this tightness, this heaviness, or this funny feeling or numbness in my left arm. And women tend more often to have these, quote, atypical symptoms than men do.
All right, Dr. Savage, thanks so much. For more information on heart health, log on to clevelandclinicflorida.org. There you'll find articles and local Cleveland Clinic resources that can help. And don't forget to join us Mondays at 11 a.m. to get Heart Healthy with Cleveland Clinic, Florida. I'm Kelly Craig.
Get Heart Healthy on Live Miami at 11 is sponsored by Cleveland Clinic, Florida.